Roughly 1/3 of women in our community will have a caesarean section. It's the most commonly performed surgical procedure globally. And so I think it's therefore important for us to discuss what caesarean section is and some of the controversies around rates of caesarean section, as well as the need for caesarean section and the role that it plays in providing safe care to mothers and babies, not just globally, but certainly here, right here, for our patients in Melbourne. There's many things from a medical perspective with regards to caesarean section that we can also perfect. And that is things like where we place our incision. Is it as low as possible so that you can wear a bikini down at the beach later on and no one's going to notice? Can we keep our incisions as small as possible, not only from a cosmetic point of view, but also if our cut is smaller, our recovery is going to be quicker and it's going to hurt less. How then we repair different layers of the operation, the materials that we use. We're really lucky in the private sector that we tend to have access to the world's best materials with regards to not just the kind of suture materials we use, but also the closure mechanisms that we use to minimise scarring and to reduce the kind of pain that people will feel post-operatively. So a lot of our research and a lot of our efforts and focus is on trying to work out how we can perform the best possible caesarean section given the resources that we have. A lot of our focus also is on how we can prevent any excessive scar formation. We use specific dressings as well as specific equipment to try and reduce the risk of keloid scarring or hypertrophic scarring. And wound care up to 3 months after the operation is really, really important to try and ensure that our women have the tiniest scars they can possibly have. The rate of caesarean section across the planet is increasing. There's absolutely no doubt about that. And whilst we might say, well, that's because it's a preference for many women, or because people who deliver babies have lost a skill or expertise set that they used to have with regards to trying to get babies out using instruments like forceps and the like, or whether there's other reasons at play, I think is worthy of discussion. Some of the reasons caesarean section rates are increasing are within our control, and some are entirely separate from what we can monitor and what we can control. There was a time, many thousands of years ago, that we didn't walk on 2 legs, we walked on 4. Now, I don't know if any of you have seen a gorilla give birth. They don't have obstetricians and midwives. They don't need them. A gorilla will be walking around on all fours, foraging around, will reach up, grab a banana, and a baby will just fall out. Their labours are generally less than 1 hour, and they have pretty healthy babies most of the time without babies getting stuck. Since we've started walking on 2 legs, our pelvises have become smaller. In addition, we've become a lot smarter, so our heads are getting bigger. We've got bigger brains, we've got bigger heads, and as a result, we need to start thinking about how we're going to get our larger heads out of smaller pelvises. So to that end, we know that an increased number of women are going to have caesarean sections. The babies just simply are not going to fit out the birth canal at the same rates that we used to. The other issue is that our level of acceptability of anything less than perfection has reduced. I remember speaking to one of our relatives, a lot older than me, a lot older than most of our patients, and I asked her about her birth journey or her fertility experiences, and she had 11 kids. And she said, you know what, Vinny, we first had a boy, then we had a girl, then we had 2 more boys, but one of them died. Then I had a miscarriage. Then we had another girl, but she had some hot milk at a train station and then she died. It was interesting to me that there was an acceptability there that we were going to have large families and not all of these babies would survive. 2023 in Melbourne, in Australia, we have a presumption that all of our babies are going to be born perfectly every single time. And I think the majority of our women have that right to expect that. That expectation is completely reasonable, that we should have babies that are not compromised because of a lack of oxygen at birth. And that's why we monitor our pregnancies so closely, and that's why we monitor our labours so closely. So as a result, sometimes in order to save a mother or to ensure that a baby is safely delivered, we will opt to have a caesarean section. Sometimes it's not the decision we want to make, but it almost certainly is the decision we need to make. Another aspect to consider is that in almost every occasion where we're worried about a baby tolerating labour, and labour can be pretty stressful for a baby. This home that they've lived in for the best part of 9 months suddenly has the walls start caving in and out with contractions, and then somehow the baby's got to try and escape through a doorway that's much smaller than they are. And that can take hours and hours and hours. Whenever we're worried about a baby tolerating that process, our opt-out is a caesarean section. That is to say that frequently, in order to save a baby's life or to deliver that baby safely without any compromise to oxygenation of the brain, we will opt for a caesarean section. It is far less stressful, and there will be fewer periods of reduced oxygenation to the brain at caesarean section versus vaginal delivery, particularly given that vaginal delivery generally takes longer than caesarean section. From purely a medical perspective, babies will, as a rule, tolerate caesarean section birth much better than they will vaginal birth. That is because there is a shorter period of time, if any time at all, that the baby's brain has a diminished oxygen supply. It therefore follows that in the vast majority of cases, babies are going to be born in a healthier condition at caesarean section on average than at vaginal delivery. There are so many things about pregnancy care that reiterate in my mind this unbelievable and inconceivable bond that a mother has for their child, whether that child be born or yet to be born. And that starts right at the beginning. From the first time we see a flicker on that ultrasound, you can see it in both mothers' and fathers' eyes, just how much they love this collection of cells that isn't even really a human as yet. It's actually inspiring. It's incredible. These women will jump in front of a train for this group of cells that they're yet to meet, and yet the baby couldn't care less about their mothers. It is the most efficient parasite you can imagine. If it's running low on calcium, it will rip it out of mother's bones in order to make sure its needs are met. And yet women will do just about anything for this yet to be born baby. And we see that at the other end of pregnancy as well. Not everybody's going to be able to have a vaginal birth safely. And that safety might go to the mothers, in which case they'll say, no, I'll keep pushing, I'll keep trying. But the minute we worry about the safety of the child, these women will say, no, I want to do anything at all to ensure that my baby is well looked after. And if that means going through a surgical procedure, where my skin will have to be incised in order for a baby to come out safely, they will do that. And it's something that I just can't explain. Having a caesarean section doesn't take anything away from a birth experience for a woman, nor should it. If anything, it speaks volumes of just how much these mothers love their children, that they'll do just about anything to ensure that their baby is brought safely into the world. Similarly, we often will perform a caesarean section not just with regards to the baby's health, but also in order to look after the mother better. There's a variety of reasons in which many women will just opt of their own accord to have a caesarean section, and I think that we should be respected. Frequently in our community at the moment, we have many women who feel that they've been pressured or forced to have a vaginal delivery, and often that pressure comes from the people who care about them and love them the most. It comes from family members, our sisters, our mothers, other people who create an expectation that we should try and have a vaginal birth at all costs. And some of those costs can be quite significant. We know that women who have vaginal birth, whether it's with instrumentation like forceps or vacuum, or without any intervention, have significantly increased risks of pelvic floor dysfunction, of incontinence in later life, as well as discomfort. The recovery from a caesarean section, on the other hand, is far, far more predictable. We know that as a general rule, women will have a spinal anaesthetic or an epidural top-up for their caesarean sections. They tolerate the procedure really well. They're usually up and walking the next day, and then over the next sort of 7 to 10 days, their lives will slowly return to normality. That kind of predictability is not always there when people have a vaginal delivery. Sometimes it can go exceptionally well and the baby just falls out, and women are well and truly on the road to recovery the same day. And sometimes, unfortunately, we have women that will suffer lifelong consequences of a traumatic vaginal birth. And in fact, they may well opt to have a caesarean section the next time because of that kind of trauma. Another very valid reason that we perform caesarean sections is because a woman has made the informed decision that she has chosen to have her baby via that route, based on the risks and benefits of vaginal delivery versus caesarean section, that she has chosen to have a caesarean section, and I think we should be really supportive of that to try and make sure that her birth experience is as good as it possibly can be. We know that women who have caesarean section as compared to a vaginal delivery experience significantly lower rates in terms of the rest of their lives for things like pelvic floor dysfunction, urinary incontinence, pain on intercourse, and a variety of other things. These are many reasons that women might choose to have a Caesar over a vaginal delivery. We also know that their recovery route is significantly more predictable. We know that the vast majority will either have a spinal anaesthetic or an epidural. They'll tolerate the procedure very well, they're awake for it, they might be involved in it, in that they might be involved in a maternally assisted Caesar where they'll deliver their own baby at caesarean section. They can still have skin to skin straight away. The next day they'll be up and walking around, and then over the next 7 days to 10 days we'll make much more of a road to recovery. For many women, this predictability, this very much knowing exactly what they're going to experience when and where and how is really important. Section really should not be a dirty word. The incredible amount of expectation and pressure that we put on women to strive for vaginal delivery is immense. Sometimes those pressures come from the most unintended of places. The women in our lives who care about our women the most, their mothers, their sisters, their grandmothers, having had a less than perfect birth experience themselves, will regard that as some sort of a rite of passage that everybody has to go through. The reality is that, as I've said before, roughly a third of women will be unable to deliver their baby safely via the vaginal route. And when that happens, it's important for us to recognise that there's no failure on behalf of that woman or on behalf of that baby to not have a vaginal birth. But sometimes the decision that we need is not the decision that we want to have to make. Some of the reasons that we try and lower the rates of caesarean section globally have little or no bearing in the context of a woman or a family having a baby in 2023 in Melbourne. We know that women who have had a previous caesarean section really should be able to access caesarean section quickly in subsequent pregnancies in order to protect their safety. The reason that is less of an issue for our patient population is that all of our women have access to hospital facilities readily with subsequent pregnancies in any case. We try and lower the rates of caesarean section in other countries because we can't guarantee that those women will have hospital access and ready availability to emergency caesarean section should they need to. However, our community, that availability is always there. In fact, very few women in our community live more than about 30 minutes away from a fully operational operating theatre with a team that's on standby in order to provide that care should it be required. There are several parts of the world where ready hospital access at a time of need is just not there. One of the small risks of having a vaginal delivery after a caesarean is that the uterus can tear. That risk is roughly 1 in 200 or 0.5%. But if that does happen, we need to be able to get that baby out as quickly as possible to limit the amount of blood loss for both mother and baby. The reason that we try and reduce caesarean section rates in several other countries is because we can't always guarantee that that facility will be there for those women. But for us, in our community, that facility is always there. I wonder whether our focus should shift, not necessarily on concentrating so heavily on caesarean section rates, but starting to think about how can we perfect or make a caesarean section as good as it possibly can be in the situations where we need it. It is the most commonly performed surgical procedure on the planet, and yet it would seem to me that no two practitioners seem to do it exactly the same way. So that tells me that caesarean section hasn't been perfected as yet, and we constantly can keep thinking about how we can make it better. Not just from a medical point of view, but also from an experiential point of view for our patients. So we put a lot of thought into this for the roughly 1/3 of our patients that will end up having a caesarean section. Involving our patients as much as possible in the procedure is really important. We're kind of lucky because most of our patients will know most of our team by the time they come to our theatre. So the environment is not unfamiliar to them. And our patients pick up on that straight away. They know that we know each other and we like each other, and it's a very warm and comfortable environment. We can adjust the lighting in our theatres so it's a little bit more homely rather than feeling like a really clinical kind of a place. Most of our patients will have an idea as to what kind of music they want to listen to, which family members they want to bring in with them. We can get our patients to be more involved in their own procedures. We do maternally assisted Caesars so that women can deliver their own babies. We get skin to skin involved as quickly as we can. We tend to work with the same paediatric team so that we all know each other, and try and make the environment as minimally daunting as it possibly can be. And as a general rule, just like with vaginal births, we ideally want this to be the most memorable and happy day of these people's lives. It's absolutely imperative that we stop making women feel guilty about having a caesarean section. Wherever the guilt or wherever the pressure comes from, whether it's from the community, whether it's from other health professionals, whether it's from those who love and care for us the most, whether it's people's families, their sisters, their mothers, their partners, we need to stop making women feel guilty about caesarean section. It's the most selfless thing a woman can possibly do in order to demonstrate their love for their child in many situations.